Hello, everybody. Welcome back. Hope you all had a great Diwali break and we're already heading for the next festive season. So, welcome back to my Wellness Wave Deep Dive with Dr. Trishalla. And I'm so glad that you have been giving me such a beautiful response that I'm continuing to do so, and I'm continuing to have some new guests over to do a live session with me. And today's session is also going to be very exciting because one, it's not my domain, so I don't talk about this very often, and even when patients are giving me such questions, I don't really have an answer, so I normally send them to the other specialist. And today's topic, I'm going to learn about it a lot. So today I have with me a dentist who's young but who's very passionate about what he does, and he can definitely make you smile and give you a very good smile. So before let's not waste time and get Dr. Shardul on the live session. Dr. Shardul. Dr. Shardul, can you see me?
Hello, good evening, boss. How are you?
Hello, good evening. So good to have you here. Welcome.
Very excited.
Wellness Wave.
Very excited for the topic.
Same here. I think you have a little bit of unstable connection, Dr. Shardul.
Is it?
Yeah.
You're is it not audible or you can't see me? What is the thing?
It's a little distorted and I can't really hear you very well.
Can you give me 2 minutes? I'll correct that. There might be something with my Wi-Fi.
Oh, please do. Please do. We're
Give me
just
2
waiting
minutes.
for you right here.
Yeah,
Sure. Sorry. He's going to be back very soon, and we're going to have some very interesting discussions about smart toothbrushes, which I think a lot of us have been actually seeing about. Probably a dentist has recommended, and I have actually shifted to an oral smart toothbrush. Smart toothbrush is basically वो charge करके चलता है and काफी अच्छा चलता है. I kind of like it, but उसके अलावा उसके क्या benefits हो सकते हैं? I think I'm going to wait for Dr. Shardul to actually share that with us. So just bear with us for a moment. He'll be back shortly. And meanwhile, if you have any questions regarding anything related to dental care, oral care, anything that you're going through, you're confused, and if you want to check with Dr. Shardul, please post your questions on the comment section, and we'll try our best to make sure that Dr. Shardul is answering that for us. I've seen some amazing people joined in. Dr. Shardul, have you managed to correct your internet? We don't want to miss some interesting questions, hence I'm asking you to correct the sessions. Okay, he's back.
Yes, I finally managed to do it.
Okay,
it was a little because of my Wi-Fi issue.
Yeah, no problem. I just wanted to make sure that, all these important questions and the discussion is not being missed out because of some technical errors. So that's great. Welcome on Wellness Wave Deep Dive with Dr. Trishalla. And I'm so glad to formally have you here. We've been discussing things informally, but it's good to have a colleague connection here on this live.
Right.
So, Dr. Shardul, can you share something about what do you do? How do you practice? Where do you practice?
I'm a dentist. I'm an orthodontist. I practice in PCMC Pune, Pimpri Chinchwad. I have 3 clinics in Pimpri Chinchwad itself. And I also do Cosmo procedures. And I'm planning to expand to the east side of the city, that is towards Baner and other domains.
Okay.
So,
perfect.
Yeah, so I'm the second generation dentist of my family.
Oh, that's
and
nice.
I've also been working for COVID. That was my line of expertise. Plus, I was passionate about ortho, like being braces, and the rest being other things such as Cosmo, which includes Botox fillers and other procedures.
Got it. That's
and
very
just
fast.
before we start, just as a compliment, you have always been a constant and a silent support or an inspiration. I always see it up to you. and then we share a lot of things, exchange a lot of knowledge. And this, I'm more excited to like do it for you, because this is not your domain, and still you want to have this on your board. So yeah, that is more
Yeah.
exciting.
Yeah,
So
I
yeah,
think,
moving on.
there's no point, Dr. Shardul, to constantly keep talking about what I actually know.
Right.
I want these sessions to be in a way that even I am actually taking away something, and it's just beneficial to our patients, right? कि किसको दांत में दर्द नहीं होता है, या कौन टूथब्रश यूज नहीं करता है, right? So this is a
Right.
topic that all of us can relate to, and I think it was also the need of, because a lot of people have been talking about this who are actually not the experts. So a lot of Instagram influencers have been taking over
Yeah, the
this,
the
and
the the paid influencers are always there, who get from a
correct,
particular brand. They
correct,
have been there, and I see a lot of them as skincare also. And that is not everyone has the same set of skin. Everyone has a different set of skin. Everyone has a different set of teeth, so it differs. So
correct.
being going to an expert is a much better solution for
Yeah,
any of
I
the.
know, right? Sadly, we have so much noise over social media that now it's been very difficult for us to understand कि किसका सुने, कौन actually expert है, कौन नहीं है, and that was my reason to start with this, so that at least there is one place where we are talking about one topic by the expert.
So
So without wasting time,
due to the sound on social media, my patients come up to me and they tell me things. They teach me things.
oh
So it has become
my
like that.
God, talk about it.
Yeah.
Talk about it. That's the list is ongoing. So quickly, let's get into the topic. For what I actually have you here. So, what are these smart toothbrushes? I mean, it's been a buzz in the market. You go to any grocery store or you are shopping online. They're
Right.
everywhere. We are talking about shift to a smart toothbrush. होता क्या है ये? क्या है ये सब?
Boss, so telling in very simple terms, firstly we used a toothbrush which is manual, which only has bristles. The bristles are counted by proper DCA, like the Dental Council of India, DCI, and then also as WHO has a particular diameter for everything and a particular number of set. We have been using that since since when we are growing up. So since technology is coming, it's stepping in everything, like all the sectors. So we have prosthetic arm, that is also technology. Like in particularly in the healthcare sector, this has made a major move. And coming to the oral healthcare sector, smart toothbrush is basically, boss, I will tell you, it is an electronic toothbrush which has a sensor. Okay, and this sensor, when you brush, it controls your recording. Plus, it captures your recording. It has three types in the like in the sensor itself, which can capture your recording.
Okay.
How you're making a toothbrush, how the movement is there, and according to which you can set your pressure, you can set everything. And so how people are going, the people, what do you think is, it not might not be useful for me, it might not be useful for a patient who has gingivitis, basically gums which are inflated.
Okay.
Or you, it might be different. For a diabetes patient, it might be different. It is not usable for everyone. So basically ये होता है.
Okay, so I mean, I was not aware about this. I thought smart toothbrushes are for everybody to use. But yeah, I mean, now that you say, I shifted into smart toothbrush like about a year back, and it does put a lot more pressure and to the areas where probably it was not needed. So honestly, वो तो smart है, तो हमने सोचा कि इसको सब पता होगा. But certainly that was not the case. So this is a very big difference between a smart toothbrush की वो sensor से चलता है, and it's not necessary that everybody can actually use the smart toothbrush. So that's one good, very learning point
So
for us
sensor
today.
से चलता है. The sensor has three components. First is accelerator, second is gyroscope, and third is magnetometer.
Okay.
Okay, these
All
are three parts of the sensor.
Sorry.
These are basically accelerometer, how it accelerates, magnetometer, the way of recording. It is like this or like this. And third is normal accelerometer, ki how much pressure is being used or how much speed it should be. So it might be different for a pedo patient, and it might be different for a normal patient.
Correct. Got it. So, are there any stages of this? Because I don't think my toothbrush has all three. I think it just stops in 90 seconds. But
So that is again comes in gyroscope.
Got it.
Gyroscope
Okay.
का function है कि it will only go for 90 seconds.
Oh,
You can set
okay.
your time accordingly, like 1 minute 30, 2 minutes,
Got
depending
it.
upon
Got it.
how much severity of your teeth, you know,
Oh,
how much of the gums, teeth, everything.
oh, okay, got it. So, different toothbrush probably are, that's why we see difference in the price range also, okay? Not everything is in the same price range. There are some which are cheaper, there are some which are very, very expensive. So I think these three things matter. And I
Right.
think you should talk to your dentist to actually understand that which is good for you, because honestly, what I feel is that after shifting to smart toothbrush, my teeth has become more sensitive. So I'm actually facing a lot of sensations which was never the case. So
Well,
probably the smart toothbrush which I got is too harsh for me. I think I have to check with you that which one I should actually shift to.
well, that is something that differs from patient to patient. It will
Correct.
not really make it sensitive, but probably what might have happened is it might have removed your plaque, which is there, which was not normal by the
Hmm.
interdental toothbrush or the manual toothbrush, which was not being able to wear off. It went by the smart toothbrush, and that is why you feel sensitive. It might be. I'm just taking guess.
Yeah, yeah. Yeah. This platform is not for medical advices. We're just probably going through, because maybe if I'm going through this, somebody else also facing the same issue. So I mean, why is oral care so important? Like, क्यों इतना important है हमारे दांत का ख्याल रखना,
So
gums का
basically,
ख्याल
if you
रखना? We,
talk about the mouth
yeah,
only,
sorry.
so only it will be affecting 90% of your health. Only your mouth, because you start
Correct.
your day and you end your day with your mouth. Your toothbrush for your day and night have to be different. What you use in the morning and what you use at night have to be different.
Okay.
Okay, and they have to be repeated in a time span of 3 to 4 months.
Okay. Got it.
Okay, and so when we talk about holistic or like a complete as a whole of a healthcare, it
Yeah.
starts with your mouth. When, like, if you say one of my patient, she had gingivitis, and
Inflammation
that
of your gums.
gums,
Hmm.
yeah, to make it more simple, inflammation of your gums. So that used to give her bad breath, and there were a lot of causes to it, and then she used to feel very uncomfortable or confident to talk
Hmm.
about. She was very beautiful as a patient, plus there were a lot of qualities in her, but only because of her oral hygiene there were stains. She was not confident about her smile. So basically you see 90% of your face value decreases, your confidence goes down, and a lot of things add up. So when you talk about oral health completely, leaving aside our today's topic, like only not sticking to the topic, but there are other things also which play a role, like cavities, dental pain, any other which you don't take care of generally, then they lead to a lot of psychological pain, because a dental
Correct.
pain is the most if you have a good dental health, you have a good mental health in straight terms.
That's so true. While you
Yeah.
talk about it, I'm actually feeling the pain already that I've already gone through with so many dental procedures. I didn't have Dr. Shardul back then,
Back
right?
then,
When I
right?
was growing up. So
Yeah.
super good. Yeah, so oral care is important. And in fact, just adding on to a point is our gut starts from our mouth.
Right.
So
Definitely.
so everything that's going on in your gut health also has to be connected with your oral care, because
ninety
यहाँ से
percent
शुरू हो रहा है.
90%.
Gut is not your stomach. Gut is where your mouth and what's going on, sometimes even cavities or anything that affects your oral health is affecting your entire system. Sometimes I've seen people getting acid reflux just because they had an infection which they left untreated. So nobody could actually connect to this, but when nothing is going on, everything is fine from my aspect, I'm like, please see a dentist. Please see if there's something which is being missed out, and we come up with the thing that an infection, it's gone so bad,
So in this
that it's
duration,
really hurting.
patient usually takes 1 to 2 weeks to just come. So that time during that
Yeah,
time for his 2 weeks, his sleep has been compromised,
correct,
his mental health, basically psychological health, has been compromised. He cannot focus on work. There are
correct.
a lot of things, like
And
it is not only that his
painkillers. You're popping in painkillers left, right, center. I mean, see, I'm sorry, but we don't like dentists. I mean, I don't like a dentist. I'm very sorry,
we are very
because
cute.
they're the most ruthless people I've come across. But फिर कुछ ऑप्शन नहीं होता, हमें जाना पड़ता है, right? But उसके बीच में we don't even see कि कितने घंटे हो गए हैं. The pain comes back again. Another pill is in our mouth. So it's really also impacting a lot to do with the other organs, just managing your dental pain.
It definitely does. As you said, it starts from your mouth. Your gut starts from your mouth. So coming back to the same point, until and unless this has been solved, and there can be other things also which contribute to it, not only a cavity or anything,
Yeah.
but there are other things also like bad gums. There might be ulcers, etc. A lot of things. So being negligent is not only the solution for it. You should always go visit a dentist between 5 months, 6 months in that duration, and you should have a full oral checkup, and you should be very aware about these things. Only having
Yeah, I mean, if
painkillers
you're
will
getting
definitely not
something,
help.
if you're feeling a little funny in your mouth, I think it's always good to take an opinion,
Definitely.
just see if everything is okay. You don't have to wait for it to get really, really worse. So that's very important, guys. I mean, I am not going to follow it because I'm very scared of dentists and I'm being a very honest patient right now. But having said that, because I'm aware about something is not okay, I'm able to take action pretty quickly. So
But
that really helps.
if you keep your pain subsided with the painkiller, just an example, just taking you as an example today, if you have a pain, you're taking
Yeah.
a painkiller, the pain is gone temporarily.
Yeah. Yeah.
That might lead to an infection.
Yeah.
Because you never know, and that is how patient comes with an infection when the root
Correct.
canal has also reached the third stage. So first we have
Correct.
to
I mean, there's
drain
no
out the
way to.
pus.
Yeah, you're losing your tooth by then, right? I've lost it. I've lost. I'm telling this on the platform. I've lost because of my negligence, and sometimes you don't really know what to do. So getting awareness is very important. That when is the right time? What kind of toothbrush to use? What kind of? It's not just marketing gimmick. I think it's very important to discuss these things with your dentist. Ki, which
Definitely.
toothpaste is what you're going to recommend for me? Is this the smart toothbrush that I have to actually go through? Because it's not कि brush करके हो गया. Why are we actually brushing? I mean, Dr. Sharvil, why do we brush our teeth?
So if you say towards the morning, and as I repeated myself, key towards the
Yeah.
morning and towards night, we are using two different toothbrushes
Yeah.
depending upon the sugar intake for the entire day and the
Yeah.
sugar intake when we have in the morning. So in the
Yeah.
morning you brush for others, but at night you
Yeah.
brush for yourself. Okay.
Yeah.
And not only as mechanical brushing, our mouth has itself has a self-cleansing habit.
Correct.
But some people might have a prosthetic denture or an implant or other things like a cap, etc., etc., etc. For that reason you have to have a mechanical brush in your mouth, which will not
Got it.
only save you from plaque but help you mature it. Once
Correct.
it becomes mature, the plaque comes to as a calculus.
Let's make it easy.
Plaque, normal bacteria. The calcified form of plaque is called as calculus.
Okay.
So
Got
that
it.
is how you have to brush, and that is why you have to brush twice to avoid
Okay.
the sugar index, to avoid the sugar caries, and there are a lot of things which come in that. So
Okay.
basically, for a better well-being, see, I brush twice a week, twice a day, without fail. This is my rule.
Correct.
I
That's your
floss once a
job,
week.
Dr.
Yeah,
Sharvil.
I floss once a week because flossing is a very lazy habit, and we as an
Yeah.
Indian well-being, we are not grown up with and we don't need it
Yeah.
that much
Yeah.
compared to the Western well-being.
Yeah.
So I floss. I do oil pulling, and there are a lot of things which I do. So there are a lot of new things also which are coming along with the smart toothbrush, which is a smart flosser, water flosser. There are
Yes.
a lot of things, like the medical healthcare industry has gone way too ahead in terms of technology.
Yeah, correct. So, too many things. So we have to figure out and sit with the dentist to see कि मुझे इसकी ज़रूरत है या नहीं है.
Right.
Because not everything is probably made for everybody. There's a whole lot of different population, and it's just into the business that they are actually getting it, right?
So
So
as I explained it towards the start, the same point.
correct. Yeah. So that's very important कि एक structure होना चाहिए और regular visits होने चाहिए dentist के पास, because ये products खुद से खरीद के try मत करो. Sometimes it's not
Definitely.
something which is needed for you. शायद आपका case और खराब हो सकता है. So just checking with your dentist is very important.
So
And
according to the marketing gimmick, a lot of people, like even you being educated, you started using a smart toothbrush, right? As you told, just as a marketing
guilty.
gimmick. You don't know, you might not know you need it or you don't need it, or what is the
Yeah.
exact scenario of your mouth, what is your
Correct.
OI, OHI index. If I ask you such questions, you will not know. What is the pH of your mouth? You will not know.
No.
So exactly, just
I am
as a
not aware
marketing,
about it.
just as a marketing gimmick, people are doing it, and just to look cool or being in the trend, people are doing it.
Yeah. Yeah, absolutely. I mean, honestly, I got my toothbrush because वो sale पे था. So I got it, and I'm sure there are many other people like me who are on Amazon and scrolling through it and चलो ये अच्छा लग रहा है, ये color अच्छा है, ले लेते हैं. Please guys, don't do it like me. That's the reason why I've kept this, because although Dr. Shardul, I have to mention this, that after I shifted to the smart toothbrush, my visit to the dentist with the pain cavities has actually improved. And when I went to the dentist last just for a procedure, my dentist actually said that your teeth are actually healthier. So, I mean, this is my personal experience, but I want to know your expert opinion that is this just to get the business, or these smart toothbrushes are actually helpful?
So, boss, I have a very diplomatic thought on this. There is no proper survey which is being conducted or which I could study to get to your answer.
Correct.
But I am managing 3 clinics right now, and I have n number of patients depending on the systemic disease like diabetes, and they are using smart toothbrush also and manual toothbrush also. There are different types of toothbrush which they are using. Yes, I have seen a better result. I am not paid by anyone to say this, but yes, I have seen a better
This
result.
live is not sponsored.
This is definitely not sponsored, and for that reason, if there is people are using smart toothbrush, then they are not having the laziness of not having it in their entire mouth.
Correct.
Sometimes you forget some side, and
Sorry, I lost you. Sorry, we lost you for a second. You're back.
I just got a call. Sorry.
Yeah.
Yeah. So just as it is a little different towards every side. Now, one clinic which I have, that is towards the rural side of the town, where patients don't usually use the smart toothbrush, where they are very happy with they are very happy with the normal toothbrush, and they want to continue with that after the treatment also. So there, I find the caries index might not be like, it might be same. As I said, I have not done a survey, I have not studied any survey for this answer, but yeah, I have seen a better result in smart toothbrush.
Correct. Because sometimes experience count, yeah. I mean, जो भी हमने पढ़ा है, I don't think we have a strong research about
that
it.
Is
it's
just
just
about
with the experience.
Right, exactly. That is just about laziness. People just bypass laziness, and then they get a better result due to which.
Correct.
It might differ person to person. Again, like there has to be a proper survey for it to come to a conclusion.
Correct. Yeah. So yeah, I mean, you have seen a difference in your practice. So what kind of differences do you see? Is the visits to you lesser? Is the cavities better? What kind of difference actually do you see after people start using these oral toothbrushes?
So visits, I am very strict about my visits. People have to, even if you don't have a pain, you have to come if you are my patient, and that particular time you have to visit. So what I do is silently I see. Basically, we have a software in which we note down, even if patient doesn't have a complaint of that particular side, we note down that there was something like that. But yeah, there are changes such as the gum health is nice, the overall OHI index is nice as compared to before.
So can you explain what is the OHI index for our layman?
OHI index is basically oral health index. It is on the level of 1 to 5. And on your entire mouth, it has been, your mouth is divided into 4 quadrants, 1, 2, 3, 4, and it has been scaled accordingly.
Got it.
And
so you
that due to which
calculate it when they come to you. There's an app that you use. Sorry, I'm just curious.
Software, yeah, there is a software which you use.
Software. Oh, okay, got it. So you monitor it every time they come to your clinic for their visits, and then you are actually able to compare that. How is the difference? Got it. Perfect. Yeah. So these are some visible changes that you're actually seeing.
Right. There are a lot of more changes which I cannot mention because it differ patient to patient. So
but
I
these
cannot
are some common things that you've seen. Yeah. I mean, this is, of course. Yeah, guys, this is not a place for medical advice, and we're just having a normal discussion about what most of the people go through. But if you have any specific concern, if you're around Pune, please see Dr. Shardul. If you're not around Pune, make sure you're seeing your dentist just to make sure that you're, in a healthy state. coming back to the topic is, this is an additional thing that has come to my mind while I was discussing with you, is the use of these what you call it, these products like oral, you clean your mouth, you put such oral like Listerine or anything like that. What do you think about these products that have been coming up, these rinses, probiotic rinses, and all of these things? Do you
So
think it is
basically,
something that's needed?
I'm an orthodontist. 10 out of 10, 9 patients of mine are for ortho, which wear braces. Just have an imagination. For them, I cannot give a smart toothbrush. I have to recommend a soft manual toothbrush. Okay. For them who are not using a harsh mechanism or mechanism of action, or where there are spaces, there is crowding, that is when a mouthwash is being used.
Correct.
Yes, mouthwash definitely has a better mechanism of action, but it again varies from person to person. As health varies from person to person, same way even a mouthwash or a normal brush, when the patient is brushing, you can come to a conclusion that a normal orthodontic patient and a normal patient, जिसके मुंह में वायर है और जिसके मुंह में वायर नहीं है. So if a patient is a smoker and a patient is a non-smoker, like a tobacco chewer, basically consumer, so the mouthwash is not going to help. The same way it comes down to this factor also. If a patient is a non-smoker, it might help. And there are other things also. There are floss, there is water floss. Everything has its own mechanism and main time on patients, when patients do it and how often they do it. That is how the results also feel. But yeah,
got it. So
I refer it to all my ortho patients.
Okay. So does it replace brushing? That's one common question which I'm sure everybody has. कि मैं तो mouthwash washer use कर लेता हूँ और मैं तो brush करने की मुझे जरूरत नहीं पड़ती. So does it replace brushing?
So you're just asking me, does video call replace an audio call?
Correct.
Audio call is different, video call is different. This has a very different mechanism. This is a liquid which is going in your mouth, and flossing is completely different.
Correct.
They have to go hand in hand.
Yeah, these are three separate things. Let's not club all together and say कि इसका replacement हो सकता है.
There is no replacement. They can just work as a partnership. That's it.
It's an add-on. It's not a replacement.
No.
And it's not even necessary. It's like it's not like you have to spend a bomb on your oral health. I think
definitely not. If you don't, then you have to spend a bomb, definitely.
Yeah, exactly, right? So that's a good thing, because I don't want people to feel that these products are something that is absolutely necessary और इसके बिना जिंदगी नहीं चलेगी. अगर अच्छे टेक्निक्स से हमने ब्रश किया, even normal toothbrush से, वो भी चलेगा. It's just that if you're looking forward to improving your oral health, then these are all options that has come as an add-on, which me and Dr. Shardul are discussing. So are there any drawbacks to this that you have seen, Dr. Shardul? Have you seen कि यार oral smart toothbrush पे shift हो गया है, तो ऐसा कुछ है जो नहीं होना चाहिए था या normal toothbrush पे नहीं होता है? Are you seeing anything?
So be a marketing gimmick. Like people get influenced more by that even when they don't need it. A diabetic patient should never use a smart toothbrush because he naturally has gingivitis. Okay. So the drawbacks are people are using it just as a trend, just to look cool, just to, the result might be there, might not be there.
Correct.
It varies. They might not need it, and sometimes it might erode your like gum, which the pressure does not match, or sometimes it might not be. The limitations vary from systemic disorders, if the patient has, or any other diseases. Then coming to the second point is the cost. Limitations, when we talk about limitations as a medical product, it is a little expensive, where not everyone can afford, or you cannot replace it in every 4 months, which you should be doing. So it is very essential to have a cap on your sensor. Like if this is a toothbrush, you should have a cap on it. So you can use it more often. Because people cannot do it, and if your sensor falls, or if your toothbrush falls, if it's a manual toothbrush, obviously you can wash, use it again, throw it, replace it. But if this is the sensor one, then what are you supposed to do? You cannot change it, or you'll have to buy a new one, which is again a very expensive factor altogether. So drawbacks or limitations, they come with these points only. But yeah, results go hand in hand. There are drawbacks किसी चीज को ऐसा नहीं है कि नहीं है, but yeah, they go a lot hand in hand.
Okay, good. So now people would be, I'm sure, very excited to jump onto a smart toothbrush, because we've been discussing this for almost half an hour. And does it replace the cleanings or those appointments with dentists that you actually go periodically?
So for me, I am not a correct person who can answer this, because my patients, they have a particular set. Even if you don't have a pain, even if you don't have, you have to visit.
Correct.
Okay. There are when there is nothing, I keep free visit for my patient, just to make them a little more aware, and just so that they avoid more problems ahead. So on that basis, there are a lot of things. So I am not the correct person for this answer, but yeah, I would say there is having a smart toothbrush, it will not clean your teeth necessarily good. If you use the right technique, if you use the right pressure, right amount of toothpaste, right amount of time.
Correct.
As you said, use it for 90 minutes. As I said, even 90 seconds. As I said, I use it for 2 minutes. My
Correct.
sensor speed might be different. Your sensor speed might be different.
Correct.
So it again depends. So this question I'd like to pass, because my patients, I keep visits every month.
Yeah, fair enough.
Once a month until they
Well,
enter.
and I don't think the technology is ever going to replace your visit to the doctors. Maybe it will reduce your visits with the amount of pain and the difficulties that you go through, but it's
Right.
definitely not a replacement कि अब मेरा आयरन के दांत बन गए हैं, अब तो मैं कभी मुझे डेंटिस्ट को देखने की जरूरत नहीं है, just because I've shifted to smart toothbrush. I think
Nothing
that
as such.
attitude
Nothing.
is
It is
something that
not
we
going to
don't
clean
want
your
to
teeth
encourage.
any better. It is going to be correct,
Correct.
as you do manually. It is just a little expensive towards an elite side. Not everyone can afford it, but
Correct.
it is not going to clean it. The technology is not that fast that it will, bypass everything, or it will remove all your cavities. Yes, it will give you a better result, definitely, but
Correct.
it depends upon the patient also on how you use it. So even when aligners came, aligners have failed because the patients cannot use it.
Oh, I didn't
Yeah.
know this.
The same goes here. The patients cannot use it, and that is how there is no proper knowledge, and that is how it varies hand in hand and patient to patient.
Do you think the market for this is going to soon fade out just because people are not aware about how to use it?
I will not let it happen, because I am a healthcare entrepreneur as well. So yeah, if some brand is collaborating with me, I will definitely focus on marketing, including the awareness being the first part, and making it a little bit affordable in the price range, where people
Correct.
can, at least, if not, there should be a detachable bristle part, or there should be something like that, where people can do it more often, or they can change it.
Correct.
And there are easy options available for that basis.
Got it. Yeah.
And even there should be a diabetic, like you see, there are diabetic sweets, mithai, laddu. There are diabetic Diwali mithai.
Another scam.
So there should be, so there should be diabetic toothbrushes also, which are smart. So
Correct. So
that way it will not fade, definitely not fade. But yeah, there have
it's
to
just going
be
to
some steps.
improvise.
Yeah. There have to be some steps. People are usually bored of using the same thing again and again. You have an iPhone 11, then you have an iPhone 12, then you have an iPhone 13, and so on. That same way goes on in dentistry also. People have the same brush. Then it comes, the stretchable brush, then two-sided brush,
Color,
blah, blah.
color, wala
Color, that. So something of that sort only. So that this market is not going to fail, and I, as a medical entrepreneur, I won't let it fail.
Yeah, I mean, it's something which is good. It's needed. So why not? Just making it, your point is absolutely right, that to make it affordable so that the masses can actually use it. It's not supposed to be just for the elite population. ऐसा कुछ होना चाहिए कि हमारी basic population को भी ये मिले, and I'm sure there are companies who are constantly working towards it. And so, Dr. Shardul, when do you think that the smart toothbrush is not working and it's time for you to actually pay attention कि क्या हो रहा है?
Well, it is quite early to answer this question, because people have just started using it from 6 months back, or post COVID, and it is still in the process to having a survey on it.
Fair
and
enough.
being having a concrete opinion on it, where the limitations we can decide कि काम नहीं कर रहा है. Now only it is कि when it is at excessive pressure and excessive speed, a diabetic patient cannot use it. So
Correct.
there might be
so that's
a few
one
more
flag.
Yeah, there might be a few more points which we don't know.
It's still, yeah, it's just coming up, and I think we learn everything every single day. It's something which keeps coming up, and that's so, everybody, I mean, if you're going through a symptom which is abnormal, if something in your mouth is not feeling okay, I think despite of what toothbrush you use it, please take it up. Please speak to the therapist, speak to your dentist or physician or anybody. Take it up. किसी को बताओ, somebody will give you the right direction about what
This
to
is
do.
this is definitely a good point. Don't be your own doctor. Please visit the doctor.
Yeah, that. I mean, I can understand doctors can be scary, dentists can be more scary.
No,
I will
dentists
agree
are
on
cute.
this
Dentists are
point.
cute. I'm cute.
Are you cute? Yeah, I mean, but you're still dentist. So that is going to be there. But when I come to you, I'm sure you're going to make me feel better so that I don't panic as much as I normally do. But this is a very important point, actually. Dentists, the word is so scary, but they should be really very calm to deal with it. I've seen a lot of people that really lose their temper when the patient is not cooperating. And I think this is one profession where the patients are very hesitant to visit. So I think
So
the
this
way you're conducting with the patient is also very important.
so this happens on 50% scenarios when the patient does not cooperate at all, especially in pedo cases, or when we are telling something. We have a patient's level. We have the day to go forward. We have more patients to see, and when we are telling something, then probably you have to cooperate. You have to be, it is a hand-in-hand process. It is like the doctor and the patient both have to be hand in hand, and then only the treatment can go more smoothly.
Correct.
But it is not that we can show patients up to a certain level, because I am being an orthodontist. My patients are very cooperative. When my patients are doing Botox or they are doing fillers, lip fillers or something like that, so I just tell them if it's gonna pain, it's gonna be worth it. Same
That's a
goes
nice
here.
way to take it.
Yeah.
Yeah.
So
You're doing
I'm
it for
gonna
a reason.
yeah. So I'm gonna magnify your beauty. I'm gonna magnify your pain. I'm gonna detach your pain. So just cooperate with the doctor. You might get a better result.
Yeah, I mean, I will never use this word that patients are non-compliant. I don't use this word. नहीं सुनते हैं, ऐसा कभी नहीं होता है. There's always a reason behind वो क्यों नहीं सुन रहे हैं. And I think if we get to the root to understand कि वो patient का ऐसा क्या experience था that they're so petrified to see a healthcare professional, I think addressing that concern is very important. So with this, I'm coming towards the end of the session, but I want to discuss these very two important things. Is Dr. Shardul, this is not something that we are doing because a company has asked us to do it. It's not a sponsored
Right.
live. But in your experience, have
You
you
can
seen any
sponsor us. I don't
brands?
mind. You can sponsor
I'm
us.
waiting for a sponsor too. So, are there any brands that you generally recommend for normal population? I'm not talking about somebody who has diabetes or undergoing any complication, but do you suggest any brands for smart toothbrushes that normal people with a normal oral health care can actually start with, so that they take this away from the session?
Doctor, to be honest, that is not ethically correct. Firstly, secondly, when you write in the prescription, you don't write a brand. Even for medicines, you don't write a brand. You write a drug.
Supply.
So even when we write here, we write like an ortho toothbrush or a smart toothbrush or a soft toothbrush. We don't mention the brand.
Correct. So these three things, right? So ortho, smart, soft. These are a few keywords that you can look for before you are buying a smart toothbrush.
Definitely.
And then maybe if it's specific to a condition, of course, speaking to a dentist is important. But like Dr. Shardul just mentioned, that please look for these keywords: soft bristles, or smart toothbrush, something which is very basic to start with. That is something that you can look ahead with, and maybe towards your next session with the dentist, or maybe after this live, you can message your dentist that what do you think is a good option for me, and then we could take it away. And final tips for managing holistic healthcare. Anything that you would like to give towards the end?
So, doctor, giving 2 points towards holistic healthcare. So, if you divide the word into 2 parts, it has a very important significance. Holistic as in whole, and cystic as in your entire health. So, your entire health starts from your mouth. You should start your day from your mouth. You should start your day from brushing and you should end your day from brushing. There are a lot of more measures we should be taking care of. That is, if you need whatever you need, or which type of products you should use, or which type of floss you should use, the length of the floss, the diameter of the floss. Then there are other things also which play, not only the floss, but if even if you do a normal oil pulling, so there are different types of oils, right? There is coconut oil. So even if it might not be suitable for you, whenever you're using something, it comes back to your holistic approach. As I repeated myself, a good dental health is a good mental health. So just concluding that, always take care towards your start of the day and the end of the day. And if you don't have any dental pain, very good. If you do, just go to your dentist. Please don't be your own doctor.
Absolutely. Stop popping in painkillers, please.
Please
You are
stop
not
popping
aware
painkillers.
about
Yeah.
it. It makes our work really, really worse. You might not even imagine, guys,
And
but the amount of
expensive for you.
painkillers,
Expensive for you.
expensive for you. But जब आप हमारे पास आते हो, and when we are actually, so when I'm looking at those patients, oral health तो चल रहा है, चलो, and then the dentist is calling me that इनका sugar level control में होना चाहिए, otherwise I cannot go ahead with the procedure. And then I'm like, you're going through an infection, your painkillers are so much, your blood sugars are not coming under control. मैं कहाँ से dentist को blood sugar control में लाके दूँ, right?
So
this is important for you
that
to
is how we
understand.
have to start from the basic again. The root canal goes to the infection. The infection has to drain out via pus.
Correct.
Then the root canal has to take place, or else you have to extract the teeth and then go for an implant. Then it is again a hectic, non-affordable, like affordable, but a little
It's so
more
much
expensive.
painful, yeah. It's
And
just,
going under
you're
the
spending
pain
so much
again.
time. Yeah. उसके बाद 2 घंटे नहीं खाना, 3 घंटे नहीं खाना, and then the doctor who's handling the diabetes is constantly monitoring कि after the root canal the sugars are spiking, so we have to adjust the medicine this way. This is all, you can आराम से avoid this.
You can avoid, but that doesn't mean like if you start using a smart toothbrush, you don't visit the dentist.
Yeah.
Yes, you do visit the
Exactly.
dentist.
आप ये सब avoid in the sense आप इसको एक ड्रामा शुरू होने से पहले रोक सकते हो just by giving it attention, ताकि the other healthcare providers who are actually involved in your case can take a breather कि we can work on this. Okay.
Can take a better approach towards it.
It should be better, right? If somebody is going for a dental procedure with a good control sugar, it's easier for the dentist, for the patient, and for the doctor who's handling the sugars, so that we don't have to think so much. We're just performing the surgery that is required. So I think that's very important. Please don't really take your oral health care very lightly. It's as important as seeing a cardiologist or seeing a pulmonologist, nephrologist. Talk about a specialty. It's equally important. Please see your dentist for timely visits to avoid any major complications. And with that, thank you so much, Dr. Shardul, for joining me for today's session.
Thank you, boss. Thank you for having me.
It's been very enlightening. I really enjoyed the session, and I hope people are taking it away, whatever they wanted to. And if you have any questions, viewers or people who are going to watch this after the session has ended, Dr. Shardul is all over social media. It's not very difficult to find him. I'm going to tag his clinic page as well, his personal page. You can reach out to me. I can help you with his contact. Everything is possible in social media. Thank you so much, Dr. Shardul.
Done. Thank you, boss.
Hoping
Thank you
to
so
do
much for
another
having
session
me.
with you soon.
Very soon. Take care.
Take care. Bye.